Good afternoon and welcome to a very special Dean's Circle edition of the Scope podcast. I'm your host, Dr. Nicole Wadsworth, Dean of the New York Institute of Technology, College of Osteopathic Medicine. We're on location at the beautiful Sagamore Resort in Lake George, New York. It's my sincere privilege to welcome our very special guest, esteemed faculty physician, renowned medical educator, fervent researcher, author, and distinguished leadership coach, Dr. Florio Pipas. Thank you for joining us today. Before we delve into our conversation, I'd like to take a few moments to provide our listeners with a few highlights of your career. Dr. Pipas is nationally recognized as a passionate leader in education, research, clinical care, and is Professor Emerita of Community and Family Medicine at the Dartmouth Institute for Health Policy and Clinical Practice, and the Department of Medical Education at Geisel School of Medicine at Dartmouth. She also chairs the American Academy of Family Physicians, Physician Health First Initiative, and Well-Being Educators Program, and co-chairs the AAFP Physician Wellbeing Program. After practicing at Dartmouth for 25 years, Dr. Pipas retired from clinical care in 2019 to focus on education, research, and consulting related to physician well-being. Dr. Pipas has been honored with an array of prestigious awards, including the STFM Humanism and Medicine Award, the Family Medicine Education Consortium, this We Believe Award on Caring for Me, Caring for You, the 2017, 2018, and 2019 New Hampshire Top Doctor Award, Dartmouth Medical School Master Educator, and Dartmouth Clinical Teacher of the Year. Dr. Pipas is committed to improving health nationally and internationally. She authored the book, A Doctor's Dozen, 12 Strategies for Personal Health in a Culture of Wellness, which provides the framework for a wellness curriculum for health professionals and everyone else. Dr. Pipas, I truly respect your deep dedication and commitment towards promoting positive self-care for physicians and health professionals. Sadly, due to the often multi-layered, vast responsibilities of physicians coupled with hectic work schedules and societal perceptions, they can become overloaded and at times ignore the need for taking time out for personal care. It can be difficult for physicians to say no or accept that it may be too much at times. Your focus on helping physicians acquire personal skill sets and insights geared towards identifying the importance of their own self-care is truly a win-win strategy that leads to a multitude of beneficial outcomes for the medical professionals and the patients they serve. I'm excited to have this important conversation with you. So I'm just going to kick it right off. Can you tell us when you first became interested in medicine?
Going way, way back, just a couple of years. I recall even in high school, I loved a particular faculty teacher, AP Anatomy and Physiology, and she was going to medical school. She had been teaching, and I loved to teach, and she had a commitment, a vision that she was going to be a doctor. And I remember her teaching was all about not just the anatomy and the physiology, but what she was going to be in the future. You know, I was also at the time teaching aerobics, and I love sciences, and I don't have any doctors in my family, but I think at that point I kind of followed in some of her footsteps, and I stayed close to home and went to college and medical school in my home area.
That's great, and we all certainly know how important mentors are, and they help influence how we think and what we do. She sounded really important. Mrs.
Cipriani, that's right. I know that she would be proud to know that she influenced another medical career based on, a high school class.
Yeah, that's great. That's great. So where do you see some of the greatest challenges for physicians and healthcare professionals today?
Well, I think a lot of our work revolves around looking inward as well as looking at our systems. And I think there are challenges in both. So we have challenges in our way of thinking. I guess it may all boil down to culture, but we have a culture that brings us into this superhero image. And I think we buy into it out of survival. out of compassion for patients, putting them first. And I think that's a wonderful thing, but sometimes we do it at our own expense. And so I think some of our own thoughts, some of our own actions, missing lunch and skipping meals and not spending time with our own families, these are a very important part and a big challenge for us. Flip side, we have systems who have been very happy for that to happen. We have systems who are very happy for us to work robotically 24/7 and never stop because the workload exceeds the workforce. And so the demands have perpetuated that. And so I think we have challenges at both levels, the individual level and the institutional level. And I think fixing one without the other is not going to be sufficient. So we really have challenges that we have to address in both ways. We can be our own worst enemies, but many of us are in toxic environments, and despite our significant resilience as health professionals, we have not been able to thrive.
Mm-hmm. And I think from my perspective, it seems like it's worsening in the recent past compared to perhaps 20 or 30 years ago. And there's a lot influencing that.
Yes. Many people would point the finger at the EMR. I think there's a lot more to it. A lot of people would say, 2020 changed our whole universe, right? But I think there's a lot to be said for awareness. And a lot of the literature, Tate Schonefeld is one of the leaders in this area. He will say that it's really just an error previously of unawareness, and then that the awareness is what's rising because the literature is rising. We know that if we're burned out, it's impacting our patients. If we're burned out, it's impacting our systems. And so as that literature grows and we see patient outcomes fall and we see costs of healthcare systems rise, we see that we have more of a problem than we recognized, a significant public health problem.
Yeah, and I wonder, I'll sort of pose this as a question, the rise in accessibility to information, which you sort of alluded to already, and how that has impacted work process, workload. Hey. So sort of to follow up on that a little bit, how can the healthcare industry best address these vital issues such as burnout, imposter syndrome, which I see more of an educational challenge, but we see it in the GME space certainly, and the overall healthcare workforce needs?
Yeah, big problem. I won't pretend that there's a small, simple answer to it, but I believe, like any transformation, right? If we're going to lead change in something, we have to look at it from a holistic and improvement process perspective. And therefore, looking at it from the change models, right? And if we think about, the getting a needs assessment, we have to have these conversations. And I think, people are saying, where do I start? Well, getting some data, understanding what the things are that keep us up at night. What are the challenges? What are the metrics we're not able to meet and why? And are they the meaningful ones, right? So when we look at whether it's Kotter's original model or, some of the new models that are around well-being or healthcare, we think we have to have a vision. And I think some of the data that's been out there, some of the studies that have been done is that institutions that have a vision for well-being, and every hospital system, every academic medical center has a vision, but it didn't always previously or traditionally include health professionals, right? We wanted to promote the health of our patients. We're all patients. And so I think understanding how vision is going to direct this movement. And so vision follows goals follow vision, and resources follow vision, and action follows vision, and outcomes follow vision. And so I think approaching it from that mindset of change, that we have a system that's not working in so many ways. Whether you're a patient, you can't get access. Whether you're a physician, you can't go home at night. Whether you're somebody who's lost a colleague to suicide. We can't afford to continue in the model we're in. And so I think we have a lot of expertise in change. We have a lot of expertise in healthcare. And I think, when you look at all the literature, I think, in short summary, individuals need the time, they need the tools, and they need the permission. Systems need the expertise to change. They need leadership. And then we also have to, unfortunately, continue the crisis management at the same time and dealing with the as they say, driving the bus and changing the wheels at the same time. So we're doing both of those things. And so it is going to be a process. We have seen some great results in institutions that are moving forward. And, NYIT is one of those examples. Even just having the conversations that you've had at the Wellness Summit, and having faculty be able to come and describe some of their challenges and work through some assessments and some SWOTs of themselves, and be able to make plans to be able to go back and both change some of their own behaviors and change some of their systems, processes, policies. That's progress. It's huge.
Good to hear.
Yes.
So I had mentioned as we opened the conference, I feel like this is mission critical, and that as a medical school, we can contribute significantly to helping students take care of themselves so that they can ultimately be the healthcare providers we need.
There's no greater gift that you will give your students than believing that yourself. And I think that the schools like NYIT, that have leaders like yourself that believe in this mission, that are willing to act upon it, that get in and get dirty and acknowledge your own challenges and are vulnerable and authentic, are the ones that are really going to make that transformation and shift that paradigm. Because I think if we're all saying, well, it's someone else's problem and, you go fix it and it's a system issue. Well, we are the system, right? And we are the ones that have to create something better for the next generation. And I think if, at least in my experience, students, when they see us and they say, oh, you're doing fine, you're not struggling at all. And we say, that's correct. And versus, no, that's not correct. I've struggled a lot and I still try and walk the walk. Students are going to feel like they belong, as opposed to, they don't cut it and they can't be like us. And that perpetuates the imposter syndrome. So we have to stop that. We have to acknowledge none of us are superhuman, right? We all have challenges. We all have strengths, but we all have weaknesses as well, and we're just human.
Right, and to have the permission to bring the whole thing to the environment, I think, will be powerful.
Right, and to society. I know there are patients who don't want us to ever be sick, right? Patients that don't want us to ever need vacation, but we are human, and it's sometimes difficult because of the culture that has been created. But I think we're right in the middle of a wonderful paradigm shift in that. And I don't think it will have negative consequences. I think it can only help our profession.
I think so too. I absolutely think so. So I'm going to shift gears just a smidge, but still in that sort of problem solving, how to move forward. The last 2 decades, we've seen incredible advancements in technology and medicine. How do you feel about the fast-paced changes that have impacted both physician self-care and patient care?
I mean, you can't argue that technology and science are not wonderful things. I think, we welcome the change, but it puts pressure on people. And I think medicine is an exemplary profession where we have to do more all the time. And I don't see us as being as comfortable sundowning some things. And maybe there are some programs we've been doing that aren't necessary. And so how do we begin to take some of those pressures off? And, I know if we try and add even wellness into curriculum, well, what are we going to get rid of? What are we going to let go? What's the thing that we can, put aside? And so I think we have to be able to think out of the box and be creative, because we can't do more. And I think that's one of the challenges, is that more is not better. And we see that in so many aspects. I had the conversation this week at the conference of the idea of what did we take away from the whole pandemic? Like so many things paused, right? And there's some advantage in life to pause. To slowing down. People had more time with their families. They may not have had as much, community time, or they may have had a smaller bubble, but they had more intense relationships. They may not have traveled all over, but they had more connection with their own home. And so how can we learn from that? How can we bring those relationships into medicine and spend more time with mentoring? I think there's, obviously advantages and disadvantages to our Zoom world, right? We can Zoom all over the place. We can have wonderful conversations with people we couldn't have before. But the depth of relationships, I think, is challenged, particularly if you don't know someone and you're starting from a Zoom conversation. I think the students will agree that there's convenience to it, but to be able to just rub arms with a faculty member and mentor and hang out before and after class and say, hey, you know, how did you do it this way? And what should I be thinking about? And I'm stuck here. And how do I go forward? And what was your career like? And all those questions that happen in the hallway.
Yeah, those are good, really good points. And one of the things, maybe it's a fantasy, but that technology will somehow create more time and space so we can spend that time with our students, with our patients, as we move forward.
Well, we're definitely, like, if we're commuting less or, you know, in traffic less, and I guess there is, I think people are very happy with some of the flexibility. And so I'm optimistic. I'm an eternal optimist, thinking about that there is some value. You know, telehealth has some major advantages. And we have in primary care tried to move it forward for decades without success. And then pandemic, boom, it happened. And now there's also some overuse of it, right? And so we have to think about what's the right balance for moderation.
Right. Yeah, absolutely. So since 2020, you've co-chaired the AAFP Leading Physician Wellbeing Program, and last year added the role of chair for AAFP's Physician Health First initiatives. Can you tell us a little bit more about these programs and how they can positively influence the well-being of physicians today?
Absolutely. I'm extremely proud of the work that the colleagues, and many of these areas were funded originally through grants, through United Health and through HRSA grants, and now are funded through the AFP. We have cohorts of 100 family physicians that are trained each year as leaders of change and champions of well-being. The major threads are leadership, process improvement, and well-being. And so it's a year-long program with multiple in-person as well as webinars by Zoom. And the skills are taught in all three of those areas. So the faculty learn by leading change in their own lives. So we do personal health improvement plans and leading changes in their system. Not all of them, or many of them, do not have titles in leadership. They are, you know, leaders by action more so than by title, but trying to do systems well-being improvement projects and thinking about what can they do at a level of their team, at a level of their clinical group, their educational group, sometimes their community, sometimes their, you know, their university, all different levels. But it's extremely rewarding, both to validate that we're not alone, that we have many of the same challenges across the nation. The work I do with AAMC has shown me that this happens across all disciplines. It's not just, you know, my discipline in family medicine, but we're all struggling. You know, the burnout rates are across the board. There's no one specialty or discipline I can tell students to go into and you'll be immune, unfortunately. But I think the work has allowed us to have now over 400 physicians who are trained to go out there and lead change in their institutions and their organizations. And, you know, these are amazing people who, you know, many of them were struggling and near burnout and have been able to be replenished and rejuvenated. And, you know, it's not that we're all going to not struggle again. We will, but we have more tools in our toolbox. And that's the message to students as well, is that it's not going to be easy. This profession you've chosen is extremely rewarding, but there are stressors every single day.
Yeah, absolutely. So on that note, and you mentioned students, and I'll circle back to them a little bit. What are some, like, personal qualities that you think are really important to either that you have or that you develop to be a healthy physician?
Yeah, no, that's a great question. And these are ones that I still work on, right? Some may come natural, others very difficult. I think self-awareness is probably one of the biggest. You know, I think the leader who's authentic, and there's so many definitions of leadership, but the one who is aware of their own strengths, the one who knows their own weaknesses, who knows their own, you know, even ACE scores, right? We know where we've been and we know our experiences and where it's gotten us, what type of, you know, styles we have with dealing with conflicts, you know, how I work best with other people, how I handle my emotions. All of those things are critical. I think being able to have self-care as something that I would never give up is going to last us. And, you know, the literature shows that our students come into medicine compared to their peers in college that don't come into medicine very high, very well. Their quality of life, mental health, physical health, emotional health is all really high. And then they enter our culture. And so my message would be, keep your culture, right? Don't come in thinking you have to be a superstar. You already are a superstar by being authentic. And perhaps all of us as faculty and experienced physicians in some ways being more vulnerable may be a trait to share with students, so that we say, yes, I need to take a break. I need to have lunch. I need to get some sleep, right? I need to have some me time. To not think of those things as weaknesses, but to think of them as means of caring for ourselves in order to better care for others. So not to ever think that taking care of ourselves is a sign of laziness or a sign of selfishness, that doing so is our means of being good physicians.
Mm-hmm. Yeah, and by doing that, you can bring who you are, your authentic self, and not doing those things. Certainly, we've seen it, I'm sure, in the clinical practice, the physician who isn't their authentic self.
Right. Yeah, we have a lot of reactions to all the stressors, and those reactions are not always healthy. So if we can unwind some of those and do some replenishing of ourselves, then we will shine. And we're picking the right students in medical school, but we have to make sure we nurture them and that they continue to nurture themselves.
Right. Absolutely. So you mentioned a number of qualities that we would certainly encourage the medical students. Any other advice to them? I have deep sympathy for them, and they're facing so many things. I think we're somewhat contemporaries in our medical training that I didn't have to deal with.
Right.
And they walk into medical school worried about where they're going to do residency. I don't think I thought about residency in maybe fourth year of medical school.
I hope we're not scaring them too much. Come to our field; it's an amazing profession, right? But keep your eyes open. And I'm thinking back on some of the advice that I got early on in training. I think of, well, even from my family, my father was like, always do the things that's hard because it builds character. I'm like, okay. Flip side, I hear from my mother, you can do anything, but it doesn't mean you have to do everything. Like, okay, somewhere in between. I think one of my first orientations at medical school, the Dean Ganella, came out and said to us, don't let medicine be an excuse to live your life. To not live your life. So make sure you're there when your nephew gets christened, right? Not to miss these things. I also remember in residency, one of my faculty members, he was a balance trainer, and Dr. Brock, and he always said, remember in the patient-doctor relationship, there's two of you. Right. And we're always trained that the patient-doctor relationship is about the patient. Well, it's called the patient-doctor relationship because there's, I'm in that as well. There's a me in medicine. I always say there's a me in CME. There's, the I and the you in public health. There's lots of ways to remind ourselves that we have to be present in this work.
That's great advice. That's really great.
Easier said than done, right?
It's a daily commitment.
It is.
Right?
It is.
It really is.
Remembering to walk the walk.
Mm-hmm.
It's easy when we're here. Beautiful.
Oh, it's good. Yeah, this is just stunning.
Setting.
It's a good reminder. Enjoy the scenery.
Mm-hmm.
And
I love your choice of locations.
Yeah, this is really, really great. So I'd like to change gears a little bit and talk about your book, A Doctor's Dozen, 12 Strategies for Personal Health and a Culture of Wellness. So what inspired you to write the book?
It's interesting, related to your last question of, walking the walk. My husband still puts it under my pillow when I forget to walk it. But I was asked to write it because I tell stories and I'm a teacher, and that's the thing I love the most. I think my period of burnout came when I was doing too much. My plate was way too full. And I realized, I had gotten another degree, an MPH, in the middle of my career while I was already a full-time clinician and full-time, leading and leadership. I was our chief clinical officer, doing all types of things. And my mother said, how can one person do all that? And I remember thinking about, my own life and not eating well and not exercising, not spending time with the people that I loved. And I would tell stories as I taught, and I began to teach more along the lines of my students, residents, and colleagues, and realizing that many of us were not alone in this feeling. And so I began to do some research, and I began teaching courses on wellness within our curriculum. Initially, I had to squeeze it in within my leadership curriculum because that was the only curriculum I owned, and nobody would give me any more hours. So we just said, leading, I defined it as being able to sustain your own well-being. So I changed the definition and I changed the curriculum a little bit to include well-being. But it was really about the stories that I'd learned and lessons I'd learned from patients, the science behind evidence-based well-being strategies, and then teaching exercises. So each chapter has all of those. About half of the stories that I've written are about patients I've taken care of who are health professionals. And then what is the lesson I've learned from them? So it just got out to one of the publishers at Dartmouth Press that I was writing stories, and I really wasn't writing stories. I was telling stories, but they said, well, can you write those up? And so I began saying, oh, I don't know, I don't think so, but maybe. And now, it's really come full circle that it's been something that I'm just so proud of, because it's made a difference in so many people saying, we need a curriculum. We need a curriculum for our students. We need stories. We need exercises. We need activities. We need evidence. We need science. And the students really advised me on how to write it. They're like, we want the literature, but we don't want to read a textbook, Dr. Pipas. We want something that's entertaining. We want something that's enjoyable to read and give us the assignment at the same time. So
That's great. That's great. Stories are such a powerful way to teach. Yeah, absolutely. And I think for me, stories really keep you connected to what you're doing.
Yeah, I reread many of them all the time because people use it as book club, and I still feel it. I still feel the patients that I was with. I still feel those emotions and those struggles and the successes that they had.
Mm-hmm. What's been the most unexpected feedback you received from readers?
Unexpected feedback, I guess, I got to give this to my mother. Like people would say, I got to give this to my student. Everybody in my class has to read this. I couldn't put it down. I had one student say, really, Dr. Pipas, I really didn't plan on doing my homework. But I started reading it and I couldn't finish it. And I'm like, thank you for that feedback. So I think, I knew that my mother would read it. I knew if no one else read it, my mother would read it and she'd love it. But, it's been amazing. And it was written perfect timing. It wasn't timed to be perfect, but I think everything has been an imperfect storm since then. And so it's become, and the publisher will say, it's become more and more of a seller every year, which is not what happens with books. They usually kind of fizzle off. And this one seems to be. And I was like, yes, that's unfortunate because that's where we are in medicine. We are still struggling and we continue to struggle. And so it has become a timely piece to help everyone, faculty, students, residents, nurses. It really is something that can be applied to all aspects of our lives.
That's great. Did writing the book change any components of your own personal wellness journey?
I think it was really a way of probably testing me. I guess I would say that, and I do try and walk the walk all the time. It didn't really change what I did, but it did change my teaching, because not that I didn't love teaching about diabetes and hypertension, right, depression, but I teach more about, and my audience changed too. I've done less and less clinical care and more teaching around this to other health professionals. So I work at multiple schools and multiple audiences, students, residents, faculty, nursing. Nursing seems to be one of the again, very challenged health professionals. They give and they give and they give, and then they have nothing left to give. So it did cause me to really question myself and say, am I really doing these? And I could honestly say, no, I'm not. And then to be okay with that, to really accept that it was okay that I wasn't perfect. I'm not aiming to be perfect, but that I could continue to learn just as I was teaching. And I often will learn with my audiences. And I'm very comfortable doing that.
That's great. Yeah. I feel like this starts to pave the way and provide the permission for the joy in medicine.
Yes.
You mentioned already once, this is an amazing profession. Yes. And what you have the privilege to do is quite phenomenal. And that we've sort of beaten that out of healthcare providers is unfortunate, but we can regain it.
It is a privilege. And I think when we lose that, it is so sad. it is so sad to see colleagues who come into our profession like so full of joy and wanting to make a difference, and then to see them drained. It just saddens me more than anything. And I think if we can give any one of them back this sense of hope, and usually it's a pause, but as you said, it's permission. It's okay to say no. It's okay to set some boundaries. It's okay. And I had some women even at the conference say, how come we don't allow people to do part-time? We shame them. We shame ourselves, right? We have to stop that process. You give where you can, and you can continue to sustain giving. And if you give too much, you can't.
Right. Agreed. So on that note, and sort of looking into the future, how do you envision the growing acceptance, understanding, and pursuit of physician self-care will impact healthcare and communities moving forward?
Only in a positive way. There's no question that physicians capturing the ability to include themselves in the mission, in the vision, in caring for themselves can only benefit all of our patients, right? It can only benefit all of society. We know that because if we're thriving, our patients will thrive. And if our patients thrive, the communities thrive. And so, back to that ecological model, the health of every individual impacts their family and their community and their organizations and their, the universe, if you go that high. And the community can only be as healthy as every individual. And so if you think about it from a healthcare perspective, we have so much impact on people's health. But if we're not healthy, we're the weak link in that. We're not going to see the exponential results that we have the potential to produce.
Yeah. So as we finish up today, is there one last message or something you can impart on both our medical students that will be our caretakers and the providers of today? What would be that last message?
Yeah, no, I think my main principle that I work from, that took me a while to really buy into, is that my own well-being is critical to my effectiveness as a mother, as a clinician, as an educator, as a researcher. I can fill in all the blanks, right? And when my tank is full, I can do anything. Right? But when I'm not and my batteries run out, I need to pause and replenish, recharge, and come back from me so that I can give to you.
Great. Thank you. Thank you so much. This was such a great conversation. I'm in awe of your passionate quest for promoting positive health and wellness for physicians and healthcare professionals and everyone else. I would like to personally extend my gratitude to you for your dedication and compassion for care for others by selflessly sharing your personal experiences, your work, and outlining the valuable life lessons and programs for others to follow. You have personally created a vital wellness opportunities for those who provide healthcare and also for those who receive it. Thank you again. It's been a pleasure speaking with you. I'm confident our listeners will greatly benefit from your valuable insights and work. Thank you.
You're most welcome. Thank you so much. Pleasure.